kids who have severely prominent ears. Those ears can be repaired at a very young age before they enter school, so they don't face social ridicule.
My kid's a teenager, and then his friend group that are asking me kind of aesthetic questions at such an early age.
That's not nothing. Like, that's something that they're going to have to maintain. They're going to have multiple procedures in the future.
Because again, kids they can be mean.
We have to elicit this from a patient's history. Like, if they're planning to have a kid in a year or two, it's like, just wait.
Well, I think part of it is, I think what's out there in social media right now is there are kids at a younger age that are analyzing their facial features, which they weren't when we were growing up. Mm-hmm. And part of it is kind of what these individuals, these so-called influencers, are out there saying what is aesthetically pleasing versus not pleasing.
Yeah, it's called looks maxing in Gen Z terms.
Well, I mean, I looks max every day. However,
he looks min.
Your looks mid.
He looks like a douche.
Is what most people say. But it's just intriguing to me that I have, like, my kid's a teenager, and then his friend group that are asking me kind of aesthetic questions at such an early age that it wasn't necessarily the case 5-10 years ago. Are you seeing that more and more? Kind of.
Yeah, maybe not exactly that, but, like, I have 4 girls at home, and they all are into things. I mean, if some of them, maybe the subtle stuff is like all this crazy skincare. There was a huge thing for, like, skincare and appealing to, like, young kids. All these kids ordering a shitload of skincare, like crazy amounts, and there is definitely ultra interest in beauty and aesthetics.
Skin is like flawless.
Yes, and my girls, like, they're my tone. They're outside. They're like, I gotta go tan. I'm like, you don't have tan. You're brown. And like, I want tan lines and like all this funny, odd stuff that like kids do. But they're doing it though because they are definitely molded by different forces. Like, I think we were molded maybe by TV and movies. And now these kids are all molded definitely by social and obviously normal peer pressure. But their peer pressure now is all social media.
But the question is it healthy or not healthy, right? And where is it draw the line of excessive versus not excessive? And are we going to see an influx of younger and younger people wanting aesthetic services because of this of looks maxing trend? I just learned a new term today.
I think the answer is going to be yes. The question is kind of how we're going to approach it and deal with
it.
I mean,
what do you think the actual approach should be from ethical, moral plastic surgeons?
I think we've always been faced with this. We have to make sure that when someone comes in or you do anything to a patient that they understand the gravity of the situation, they are consenting, they know the risks, benefits, etc. Now, when it's a kid, listen, medical legally, obviously a kid can't make that decision. When they're under 18, they cannot, and the parent has to be part of that process. The other thing is going to be actual reality of things. Like, kids are growing. You don't want to do anything on someone during the phase while they're growing, typically, because their morphology, their physical attributes are going to change. There are a couple exceptions. Like, I think we need to draw lines.
Let's talk about the few exceptions that are out there.
Listen, like, there's some kids who have severely prominent ears, and those ears can be repaired at a very young age before they enter school, so they don't face social ridicule and getting ostracized by others, and kids can be savage, and so I think that's some things that and I used to do a fair amount of those. They can also be done when they're older, like in their teens. A lot of times my approach with patients, and I don't know what yours is, like when parent comes to see me and say, hey, look at my kid's ears, should I get them fixed? I'm like, as at the end of the day, like, I can't tell you to get them fixed. Right. This is something you can do it. But if you want your kid to be autonomous and part of that process, then wait, see what they say. If they want to drive it, then I think it's reasonable. So I think that's been typically my approach. I didn't do many at the really, really young age because, listen, any kind of procedure or surgery has risks. Putting a kid under anesthesia if you don't have to, maybe
but
not.
The cool thing about
idea.
That procedure is it can be done under local a lot of times.
Yeah.
And, that's a very common one that we do routinely because, again, kids they can be mean, right? And they can pinpoint certain things on people's bodies that have lasting effects.
Totally.
And the cool thing is what we can do is they can have that repaired, and it's great. Another one's breast surgery, right? You mentioned it earlier. A young woman comes in with very, very large breasts and inhibits kind of physical activity, sports, having to run.
Yeah, and they can be gigantomastia where they're huge. Like, they literally are causing problems. Like, that person needs help functional help, right?
Correct. So doing a breast reduction is actually an amazing operation on these young individuals. The question becomes, at what point do you do it, right? And what I tend to tell folks is, if you're actively changing, then what I mean by that is your breasts are getting bigger and bigger and bigger. You don't want to ultimately go down the road of doing a breast reduction. However, that being said, if things have been stable and they've been stable for a particular point in time and they're inhibiting activity and they're getting in the way, I think a breast reduction is a really kind of viable option.
How about when they do get children, for example?
Yeah, and so here's the deal. That's the thing, and this is a good segue, because having kids will change your body. Mm-hmm. So someone wanting to have some breast enhancement, breast lift, breast reduction, abdominoplasty, liposuction, all these things, like we have to elicit this from a patient's history. Like if they're planning to have a kid in a year or two, it's like, just wait, hang on. But sometimes people their life plan is still undecided. And part of them and living their best and feeling their best is to get where they need to be now and then plan. So I think we have to plan for that. So I think if it's acutely someone's going to have kids, then you should wait. There's no doubt. But sometimes it's hard for people too, because it could be 5, 10, 15 years, or they may not know.
But that's everything we do. Nothing we do is actually like permanent.
Yeah.
Right. And so you change an individual at this point in time,
but they continue to age.
But things change over time.
Yeah, we're really dynamic creatures. Everything's changing. I tell a patient, if you think about someone, and this is important, like, so going back to the kids, let's say an 18-year-old comes in and wants their breasts enhanced, and meaning adding volume, using like a prosthetic device. Like the thing is, like, that's not nothing. Like that's something that they're going to have to maintain. They're going to have multiple procedures in the future. They might have to have other things like a lift, a reduction. They might have to have the implants removed, capsules removed in the future if there was an issue. And like that 18-year-old's got to understand that, and I think that we're doing a better job explaining that to them, but they need to understand. So then when you're doing that even younger, potentially, that's where you get into a little gray area to make sure that they knew what they were doing. But it goes back to this point though. And I think before there was this old concept when we would do like AUGs, for example, and I hate the word augmentation. I think enhancement's a little bit better. Sometimes some patients you really are augmenting and making them huge, but we're the pendulum swinging. Like we're doing this refinement.
I enhance our partnership personally.
You enhance?
I enhance our partnership.
He distorts and depletes their partnership. Anyway, going back to this about the devices, like that's why I think it's really important to when you go into these things with patients, like they just need to know the significance of it. Parents need to know the significance, and I look at it, selfishly. I'm always afraid. Like I'm afraid, in the U.S. we live in a situation where you have to be very cautious from a medical legal standpoint, and like the practice defensive medicine, and like want to make sure people really know what they're doing, because I don't want them to come back at me and say, you didn't tell me, you didn't do this, and like we can't guarantee anything, but what we can do is we can try to be honest, do the right thing, and be there for them. And with kids, like the thing I can't like look past with these kids is like if someone has a significant like nasal deformity, and they rhinoplasty is another one that a lot of people get at a younger age, or when they're
deviated
16
septums.
or 18, exactly, deviated septum, things like that. Different cultures actually are more likely to have rhinoplasties. Don't have to name all of them, but that's a very common thing for people in after their teens. But main thing is they need to be fully grown, and I think they just need to be consenting. And if the parents are going to be handling it, then they should be aware of all the things that can happen. I think that can be done effectively and done very well. Yep. But I just want to, I want to make sure that those kids want these things. It's not being inflicted upon them. You know what I mean?
Correct. And that's really important. And I think it goes back to the first discussion on understanding the why behind all this, and really eliciting exactly the backstory behind it all. Thank you for listening to kind of the most amazing plastic surgery podcast out there, HKB. I'm here with my brother, Dr. Bharti. Please subscribe to our channel. Listen for more episodes. If there's something you want to hear about, post in the comments. Let us know.
Just two Grindians making it happen.